With anything that's done, right, everything has a consequence. So treatments are certainly beneficial for some women, but they aren't for others. And one of the debates and issues about DCIS is that almost all women are treated with some type of surgery or radiation or hormonal therapy when they may not need to. And those all have repercussions. So surgery, there can be pain, there can be numbness that can last a long time. There can be complications from the surgery itself, whether bleeding or tissue issues, all of those types of things, as well as psychological issues. With radiation, there's changes to the skin. There's changes to the tissue underneath the skin. So if there would be a later event, like a future DCIS or invasive breast cancer, they may not be able to think about reconstruction or other options that they might want at that time. A lot of women are overtreated. So DCIS has different grades of risk. Okay, so some are grade 1, and that's very low risk. The cells look very similar to regular cells. Grade 2 and 3 have a little bit different characteristics in the cells themselves, and grade 4 is considered high risk DCIS. Women who have that may be at a higher risk of getting a future DCIS or a future invasive breast cancer at some time in their life. But even that is pretty low. For a woman who has just been diagnosed with DCIS, the first thing to remember is how low her risk actually is for getting a future DCIS or invasive breast cancer. Women normally think that they have a much higher risk. They actually think it's a 4 times higher risk than it actually is, because she only has like a 10% chance of getting anything within a 10-year period. So that's pretty low. That means that she can consider several options. Depending on her situation in life, work, family, support system, etc., she may decide she doesn't want to do anything and just watch it very closely. That's called active surveillance, where there are regular mammograms set. Everybody knows she may be at a little higher risk, so they're going to be paying attention. So if anything changes, then something can be done at that time. It doesn't matter. It doesn't matter if you do anything immediately or wait later. There's no difference in survival over any of the types of treatments that a woman could have. There can be a difference in a recurrence, or what they call a recurrence. It's really a future event or not. Other treatment options are surgery, and that can be either partial surgery to the breast or complete mastectomy, which is taking the whole breast area off. She could also have radiation, and radiation is something that can help keep the odds of getting a future event in the breast area down, but not necessarily invasive breast cancer, and it doesn't change the risk for overall survival at all. None of these treatments do. And then hormone therapy is another option, and those are usually pills every day for at least 5 years. And those also have some side effects, especially for some women. Some women do very well, and some women have a lot of side effects. So those are all things to think about and consider and see what's best for each woman, depending on her life situation.